This video is looking at the trunk, so the central sort of axis of the body. Basically, we're talking about the lumbar, thoracic, possibly to some degree cervical vertebral sections. We're looking at what movements the trunk can do and the muscles that cause this movement. So you can have lateral flexion at the trunk, you can have flexion and extension at the trunk, you can have lateral extension and hyperextension. You can also have rotation at the trunk and which direction you're going in, medial or lateral rotation. So it's actually quite a versatile section of the body because there's a combination of lots of individual vertebral joints that give you quite a large range of movement rather than one joint giving you a lot of movement. It's the combination of that chain link effect of the vertebral joints. So the first basic movement you need to be able to recognize is trunk flexion and trunk extension. So if we reduce the angle at the trunk, flex or bend forward, that's trunk flexion. And the agonist that causes trunk flexion is rectus abdominis. So this, your six-pack muscle, it's the superficial muscle near the surface, rectus abdominis. Just so you get familiar with it, the muscle underneath rectus abdominis, so deep muscle, is transverse abdominis. That's one of your core muscles. You've got this big, strong core structure around your trunk to protect this lumbar area. So rectus abdominis is the agonist. Transverse abdominis is a deep muscle beneath rectus abdominis to help it. Then we have extension. So if you increase the angle at the joint, that's trunk extension. So increasing the angle at the spine, the vertebral column. The agonist for that is erector spinae or spinae. Now you can see this is it's considered one muscle, but I suspect it's kind of a group of attachments. So this muscle runs all the way up your vertebra, up to your cranium, you can see, right down to the base, your sacrum. So if these muscles contract, it pulls your vertebral column backwards and you have extension at the trunk. Of course, just to be aware that hyperextension isn't beyond the normal range of movement, so bending right back. Not often done, but probably gymnasts do that quite a lot. So we've got a pair of movements, trunk flexion and trunk extension. And we've got a pair of muscles, rectus abdominis and erector spinae. When the trunk is flexing and rectus abdominis is the agonist, erector spinae would be the antagonist, which relaxes and lengthens to allow and control that movement, and vice versa. Typically speaking, when extension is happening, erector spinae is contracting, we want rectus abdominis to relax and lengthen to allow us to bend backwards. Not always true, not always that they swap, but as a basic rule. The next pair of movements, lateral flexion and lateral extension. You can flex, i.e. bend sideways either side to your right or to your left. Both of those would be described as lateral flexion. So this is when the angle of the vertebral column decreases laterally to the side. So the angle decreases in the frontal plane. This movement's in the frontal plane, you can see up here. And we have oblique muscles. We have internal and external oblique muscles that pull laterally, that pull sideways. These are the external ones, the ones that are superficial, that are on the surface. These are the internal ones that are underneath them. So trunk lateral flexion is bending sideways in the frontal plane. Trunk lateral extension would be increasing the angle at the trunk in this frontal plane, i.e. standing back up straight, whichever side you're doing it from. Now, the diagram over here shows that from this anatomical position, if you rotate away from the midline towards your side, turn to the side, whichever direction you go, That is lateral rotation of the trunk or lateral rotation of the vertebral column. And again, it would be a combination probably of your oblique muscles and rectus abdominis that pulls you around to one side. You can, once you have turned sideways, of course, rotate towards the midline to get back into your neutral position, and that would be medial rotation. If you turn the other way, it would be this way, that would be medial rotation. So again, it would be those same muscles on the opposite side. So lateral is rotating sideways towards the side, medial is rotating towards the midline. It's worth just giving a moment to understand trunk stability. So we've talked about muscles that make movements happen, but all of our sporting actions really, whether it's in the gym, exercises, or it's executing a particular skill, or just for your own safety to avoid injury, we often talk about having strong core muscles. Now, this pink diagram shows our sort of central core cylinder. This lumbar vertebra area here is very vulnerable, actually. It's the least stable place of your body. It's structurally disadvantaged. You've just got these series of vertebral bones coping with all the stresses and strains of your body, the twisting, turning, jumping, the forces that go down through it. So it's quite vulnerable. For lots of reasons, we want to have a strong muscular core to protect this trunk area, but also so that we can execute our sporting actions effectively and efficiently as well. We don't want to waste energy having a weak core. We want it as stable as possible. So there are some core muscles that it's worth knowing the names of. A superficial core muscle is rectus abdominis, your six-pack. A deep core muscle is transverse abdominis beneath rectus abdominis. So it's this muscle here. Rectus abdominis would be on the top. We've also, so that pink cylinder, that shape there, the top, the bottom, and the sort of round the side cylinder of protection is this. So transverse abdominis goes around the side. Multifidus is a behind in your back core muscle. Your pelvic floors is the bottom. And your diaphragm is actually the top of that cylinder shape. So again, your diaphragm, your pelvic floor, your multifidus at the back, and transverse abdominis. They're all core muscles. You could probably include some other superficial muscles, such as your obliques. Your external obliques are more superficial. Your internal obliques are beneath them, and transverse abdominis is beneath it all. So core muscles protecting this central trunk area here, but also to make us efficient at executing skills. Make sure you can, I would recommend getting your head around learning transverse abdominis as a name.